There are various operations that can unblock the tear duct, and this depends on the site of the obstruction and the age of the patient. If, for example, the obstruction is at the opening of the tear passage, then a very simple operation to dilate the opening may be all that's required. If, on the other hand, the obstruction is further down the tear passage as it runs through the nose, then a more complex operation, known as the dacrocystorhinostomy, may be required. This involves creating a channel that drains tears from the eye into the nose. On the other hand, if the obstruction is in a very young child, then this could be easily treated by dilating the passages and placing a stent in the duct. Surgery would be needed if there is an obstruction, whether this is a partial obstruction or a complete obstruction. Surgery is also needed when patients have symptoms. Surgery can vary depending on the site of the obstruction and the age of the patient. Now, this could be a very simple procedure where the opening of the tear duct is dilated, or a more complex operation known as the dacrocystorhinostomy or DCR. The DCR involves creating a new channel that allows tears to drain from the eye into the nose. This can be done via the gold standard external approach or endoscopically through the nose. Occasionally, a stent is also placed within the passage during this operation. And this operation can take anywhere up to an hour. These operations can be performed either under local anesthesia or under general anesthesia, and the choice of the anesthesia depends upon the complexity of the procedure, the age of the patient, patient's preference, as well as their medical fitness. This depends upon the procedure carried out. Following a simple day case operation, patients usually go home within an hour or two with some eye drops. Following a more complex operation such as a dacrocystorhinostomy, there may be some bleeding from the nostril, so a nasal pack is usually placed for a day. The following day, the patient is given eye drops and nasal decongestant spray. If there are any sutures or stitches on the outside, these are removed the following week. If there is a stent that has been placed within, then this is usually removed around the 8 to 12 week mark. There are usually at least a couple of follow-up appointments after these procedures. The first one is usually around a week or two after the operation, and the second one about 3 months post-operatively. Following a more complex operation such as a DCR, I tend to also review my patients about 12 months after the operation.